Madhura, could you please share the PPT?
Yes, Sindhu. Give me a minute. I'll
Yeah.
share.
Great, thank you. Let's just give it another 5 more minutes for people to join in. Hi, Bijal. I guess we can start right now. Good evening, everyone. Good afternoon and good morning from whichever part of the world you're from. Thank you for joining us today for the last Chat for Change webinar on Jetsi and Wash service provisioning, mainstreaming social inclusion. Today, we have with us a great panel of experts from international and national organizations who will share about challenges and opportunities for gender inclusive urban wash access and safe and healthy spaces for the disadvantaged and vulnerable communities, including the elderly, disabled, and young children. Our panelists will be sharing their work across policy, planning, community engagement, and capacity building. Few housekeeping rules before I introduce the speakers. If you have any questions to ask, please type it in the Q&A tab and not in chat. Please indicate the speaker if you want a specific answer for your question. If you would like to introduce yourself or comment on anything, please do so in the chat tab. We will launch some poll questions in between the program, so please participate. It will give us some live insights from our panelists. Thank you, and now let me briefly introduce you to the speakers in the order of the program agenda. Our keynote speaker is Elin Anderstotter Fabre. She is the manager of HerCity initiative at UN Habitat. She has contributed to the 2030 Agenda for Sustainable Development, the New Urban Agenda, and other sustainable urban development policies. She has extensive experience in democracy, human rights, gender equality, and security in the United Nations, government offices, and civil society. Next up, we have Vishal Brahmath, who is the director of Mahila Housing Trust. She is a recognized expert in habitat improvement, community development, and housing finance. Some of her work focuses on a range of poverty alleviation issues, particularly with women, entrepreneurship, slum upgradation, water and sanitation, and other such topics. She represents MHT on several government advisory committees. Our next speaker is Raman. He is the head of policy in WaterAid India. He has contributed to several flagship missions launched by Government of India on several wash policy initiatives, including equitable and inclusive wash, such as rights of women engaged in manual scavenging, health, safety, and dignity of sanitation workers, gender inclusive sanitation policies, accessible sanitation for per person with disabilities. We have Saswati Belliappa. She's an urban and regional planner and is currently working as a safeguard specialist at the South Asia Urban Development and Water Division of the Asian Development Bank, Manila. She has 25 years of experience and works on social safeguards, social development, inclusion, and gender mainstreaming in urban development, water, and sanitation in South Asia. The final speaker of the day is Marlena Chertock. She leads communications for the WRI Water Program and coordinates among internal programs and external partners, crafts communication strategies, and manages the program's outreach and events. Marlena is a digital storyteller and poet, often writing about disability, climate change, and renewable energy, and many more. A warm welcome to all the speakers. The session will be moderated by Ayushi Trivedi, who is the research analyst and a specialist on gender and social equity from WRI, and myself, Sindhuja Janik Raman. I'm a project associate for the urban water team from WRI India. Excuse me if my video is off, the internet is not doing too well. In the last couple of weeks, we shared a poll question and also a few factoids in connection to JETC. The responses we received on the question on what is the biggest challenge that women in vulnerable communities face while accessing water, sanitation, hygiene services in cities. The most votes we received for was unsafe environment, and lack of infrastructure was the second. However, from the upcoming presentation, we'll also understand other challenges such as lack of finance and maintenance and monitoring and other factors that impacts accessibility. With no more extension of the introduction, I would like to launch a poll question before Elin takes over. It's a very simple question. It's about what is Sustainable Development Goal 5? Is it ensure availability and sustainable management of water and sanitation for all? Or make cities and human settlements inclusive, safe, and resilient and sustainable? Or achieve gender equality and empower all women? Okay, that's great. Most of you got it right. It is achieve gender equality and empower all women. However, I think the other SDGs, which is SDG 6 and SDG 11, also has a lot of several interlinks with SDG 5. Hope we could cover more about that in the discussion. May I now request Elin to please share your presentation, please?
Yes. Hang on, I just need to share my screen first.
Sure.
It's best to do desktop, right? Usually. So do you see my screen now?
Yes.
Yes, hang on. Just put all of you like that.
Yes, perfect.
Okay. So if you're ready, I'm ready.
You can go ahead. You have 15 minutes of time and it's all yours.
Yeah, I'll try to be a bit briefer. As our dear moderator said in the beginning, I'm Elin Anderstotter Fabre, and I'm leading the HerCity initiative from UN Habitat, which is the UN Agency for Sustainable Cities. And I'm here to actually give you a keynote today, but I thought it might be interesting for you to actually get an introduction to the HerCity initiative and what we do and how it could be useful to many of you. Perhaps just before I start, a quick reflection on what you just said, that exclusion to decision making was one of the top answers in your poll. And this is really what we try to do here. We try to provide a toolbox for those populations that aren't usually involved in urban decision making. So the HerCity toolbox isn't a toolbox for WASH solutions per se, but it's really a toolbox putting all these solutions in the hands of multi-stakeholders and citizens to actually inform decision makers of the priorities that they should make. And again, as you showed in your polls before, that often, not always, but often leads to a focus on WASH solutions or other similar solutions that meet the most urgent needs of women and girls in cities. So, having said that, I'll walk you through the toolbox, and then I'm happy to answer your questions and reflections later on. So, just very, very briefly, our vision is if we involve girls in urban development, the city will become better for everyone, because our experience shows that girls plan and design with diversity and different needs in mind. They don't only think about themselves, they actually think about the entire community. And we also know that these participatory processes are key for planning a city that works for everyone. So if we let citizens that are rarely heard be the experts, our cities and communities will become more inclusive, equal, and sustainable. Just very briefly, the HerCity is a joint initiative by UN Habitat and the think tank Global Utmaning, which is a Swedish independent think tank. Global Challenge is the name in English. And it's financed by the Swedish Innovation Agency, Vinnova, and we developed the toolbox in collaboration with the Block by Block Foundation, White Architects, the Swedish Union of Tenants, and Method Kits. And but the toolbox has really been a collaboration between a range of multi-stakeholders. I think we have more than 100 experts to actually develop this toolbox, and they come from public sector, private sector, research, civil society, and of course, many citizens. So just to start, this is what cities can look like in many parts of the world. They're crowded, congested, dirty, lots of litter. I mean, they feel unsafe. They aren't welcoming. You have bunches of men lingering on in various locations, and it simply doesn't work for girls and women. So bear that image in mind. And I mean, of course, you all have your personal relation to different cities and different spaces that don't work for girls, but we try to put everything into one picture here and have a global approach. So really, to put a long story short, you might be aware of some of these facts, but I think it's quite good to put everything into perspective. So as you might know, by 2050, 70% of the world's population will live in cities. And this brings enormous challenges, not least in terms of inequality. And we know that among the most vulnerable are young women in socioeconomically vulnerable areas. And research has shown that participation creates these opportunities, as I mentioned before, for more inclusive, equal, and sustainable urban development. But at the same time, there is really a lack of knowledge of how to build these participatory urban planning and design processes. How do we really involve vulnerable groups in urban development? So our ambition with HerCity is really to contribute to a range of the SDGs. We saw a few of them before, not as I mentioned, not to thematic SDGs per se, because that is the purpose of the toolbox, to actually define the priorities and the focus, but really contributing to gender equality, reduced inequalities, good and better and more inclusive urbanization, partnerships, good institutions, etc. But we also see that when we use the toolbox, we do tend to implement other SDGs locally as well. I think you're all very aware of this, but we can continue to put this into perspective. There is a huge gender gap. I mean, that's we all know that. But for example, 60% of women feel unsafe in public spaces worldwide. Between 25 and 40% of women, don't have the same access to internet or to mobile phones compared to men. Only 23% of governmental positions are held by women worldwide. And more than 30% of women have experienced domestic violence at least once. So this is really why we wanted to launch the HerCity initiative. And it actually started with a project in Sweden called the Urban Girls Movement that was financed by the Swedish Development Agency, SIDA, with the purpose to map methods and tools for increased equality and inclusion in urban development. And we could test those methods and tools that we had mapped and gathered in a pilot in 2018 in one of the suburbs of Stockholm. And then with this further second phase, we could develop this digital HerCity toolbox to bring all these tools and methods and ways of working to a global audience. It's been interesting with the COVID pandemic for us. Obviously, it's very difficult to work in the field with the youth groups when societies are totally shut down. But it also forced us to become totally digital. So today we can actually provide this digital toolbox from distance. So that people and multi-stakeholder, particularly youth, meet and discuss these issues. But we know that these can go despite this. International Women, this, and then doing a series of regional build capacity, and more than really, and I wonder is really this order. We really want to. I see my internet connection is unstable. Do you still hear me?
Yes, Elin. It was glitching for a bit, but now I think you're back on.
Yeah, okay, good. I hope it didn't switch between networks. So we really want to continue to support different actors worldwide in engaging with HerCity Toolbox and try to help you throughout the process. So don't be shy and please reach out to us if it might be of interest to you. So projects, where are we working? We have currently 10 ongoing partnership projects all over the world. You see some of the locations here. We have 600 users, 200 initiatives in 80 countries, 250 cities. I really want to underscore that many of these are very using the toolbox very independently. So we try to follow their results, and we can follow the data that they enter into the platform. But I mean, we really want them to be able to use the toolbox without our help. That is the goal. But we run 10 partnership projects. So who are using the HerCity? So a quarter researchers, a quarter civil society, quarter public sector, and quarter private sector, public and private, sorry, more or less. And here are a few just dots on the map where you could find different HerCity users. So you see in India, for example, you have quite a few locations, actually. And just looking at Asia, you see that India is totally overrepresented, I would say, or there is a very keen interest to use HerCity in India. Just scroll through a few of the projects that we're working on. So the pilot in Botkyrka, they're now implementing the girls' proposals and turning the public square into kind of a public living room, you could say. Palestine, we're working on actual national level. So we've done assessments in 8 different cities all over Gaza and West Bank. And we're trying to provide strategies for national authorities how to work more in a more coherent way with including women and girls in urban development. Huddinge is another of the projects that we're running for the moment in Sweden. It's focusing on public transportation and how to make it more safe and inclusive. Johannesburg in Diepsloot, in an informal settlement of Diepsloot, we will be working on transition paths close to the schools and some of the facilities that the youth groups in the settlement are using, and trying to create more safe and inclusive streets. And Nairobi, where we actually work around the new arts center and try to make the streets around this new arts center more welcoming to all Nairobians. So that's just a quick look at the projects we're running for the moment. So the toolbox. HerCity Toolbox promotes girls and young women's participation in urban planning and design processes to create sustainable and inclusive cities. You understood that by now, I guess. But what does it look like? So obviously, as we also addressed in the beginning here, we work from an intersectional perspective. We do work with women and girls. But we try to make this toolbox work even for other types of minorities, such as refugees, younger children, people with disabilities, LGBTQI plus communities, etc. But this is really a process, and we try to make it as accessible as possible for everyone. So the toolbox really supports the urban development from a girl's perspective, first of all, but it really guides urban actors to implement these projects through a step-by-step methodology. And it provides an open and digitally accessible platform for all. And what we do as initiators, we facilitate this ongoing dialogue between professionals and citizens. And here are our platforms. HerCity.unhabitat.org is the HerCity platform. You can reach out to us, HerCity@un.org anytime. And please follow, if you're interested, on social media, HerCity or HerCity Toolbox. And we actually I have a QR code at the end, so you could more easily access the toolbox as well. But what I would like to do now, instead of me talking all the time, is to show you a quick tutorial on how the toolbox actually works. So, Sindhu, perhaps you could I think
Yeah.
it's better if you can share it.
Yeah, I'm just going to quickly share it.
So you actually get the sound as well.
Yeah. Yeah.
So I stop share, right?
Yes. Yes, please. Are you able to see it?
Yes.
Okay.
Have you ever lived in a city that wasn't built for you? Have you ever struggled to get around a
Mm. The sound doesn't work anymore.
Then HerCity is for
No.
you. Too often, the city does not work for girls. It's unsafe, dirty, unwelcome, and inaccessible. This is how it typically looks like in many cities around the world. This is why we have developed the HerCity Toolbox to involve girls and young women in the planning, design, and construction of tomorrow's sustainable cities that work for everyone. I will show you how it works. Visit hercity.tohabitat.org. Register. Click Start. The Toolbox follows a unique process containing 9 building blocks as a digital guideline on how to co-plan cities from a girl's perspective. The Toolbox is divided into 3 phases to illustrate the urban development process. Phase 1, Assessment. It includes Block 1, Stakeholder Engagement. The purpose of Block 1 is to identify and recruit stakeholders and target groups to participate throughout the project. Block 2, Citywide Assessment. Block 2 aims to assess the state of public spaces at the city scale and to identify which areas are in most urgent need of improvement. Block 3, Site-Specific Assessment. Block 3 provides a methodology to assess and measure the quality of a selected open public space and its 5 minutes walk-in radius. Phase 2, Design. It includes Block 4, Analyzing Challenges. Block 4 formalizes brainstorming and is particularly suitable when professionals are working together with non-professionals. Block 5, Designing Ideas. Block 5 turns the ideas into designs for the new public space using a participatory digital tool, the computer game Minecraft. Block 6, Recommendations for Action. Block 6 prioritizes among the designs, crafts guidelines, and develops recommendations in multi-stakeholder groups. Phase 3, Implementation. It includes Block 7, Action Plans. In this block, the plan for the public space is set through a participatory process similar to a client-architect meeting. Block 8, Sharing Results. Block 8 communicates the results with the community, decision makers, and a wider audience. Block 9, Implementation and Follow-up. The final block aims to gather feedback on the process from participants, follow up on the implementation, and provide an overall evaluation of the quality of the public space 6 months after construction. Each block leads you through a number of activities with detailed steps to follow in order to deliver on your HerCity project. Each step contains digital tools such as checklists, calendars, agendas, manuals, forms, boards, apps, templates, surveys, and visualization services that will help you on the way to reach the expected results. As a guidance, the majority of the toolbox is intended for the project team. When girls and stakeholders are participating, the activity is marked with a white star. And when they are the main users of a tool, it's marked with a black star. You can access your data at any time by clicking on Results. What is the likely result of the HerCity process? A place where everyone thrives, that is safe, has good livelihood opportunities, and is ecologically sustainable. That's what HerCity could look like. Let her guide you. Follow us on Instagram, Twitter, Facebook, YouTube, and TikTok at HerCity Toolbox and hashtag HerCity.
Great. Thank you so much, Elin, for the great presentation. I'm sure it would be interesting to actually pick up, kind of find the connections between the toolbox and how it's relevant in WASH as well during the discussion. With no further delay, our next speaker is Bijal. I'm going to quickly share her presentation. Bijal, are you able to see the presentation?
Yeah, I am able to see it. Yeah.
Perfect. Perfect.
Yeah.
Yeah.
Can we go to the next slides, please?
Sure.
So just to introduce my organization, I come from the Mahila Housing Trust, and we work to strengthen collectives of grassroots women in the informal sector to advance constructive dialogue and actions on improving their housing, living, and working environments in cities. We work across almost 7 states and 34 cities in India. And our vision is actually women shaping responsible urban development. Can we go to the next, please? The reason we started working with women and poor women in the informal sector was that we realized, and especially we started working on housing and living environments because we realized that for most of these women in the informal sector, their house was their workplace. So for example, you are a vendor, you produce things at your home, and then you only go outside to vend. And then, when your vending is completed, you would store those goods back at your home because you don't have a storehouse. And then, a lot of the women, almost 40% of the women who are in the informal sector, they actually work from home. So these women you see in the picture are making necklaces at home. So their home is their workplace. And access to infrastructure like water and electricity is extremely important to them. And, it improves their economic productivity. So access to basic services and housing and better living environments are actually the underlying theme is that their economic productivity improves. And why women, of course, we've also experienced that when women are empowered, and when they take the leadership, the benefit actually, or they become more economically productive, the benefit would go to the entire family. And secondly, it will also become intergenerational. One woman would pass it on to her children, to her adolescent girls, and then it would go on. So I think the impact maximizes a lot. And as my colleague from UN Habitat said, we've seen that, they would include the most vulnerable and the disabled in our experiences. Next. So talking of specifically WASH, because when I say housing, living, and working environments, we have 3 broad areas. We work on 3 broad areas where we develop women's leadership. One is, of course, habitat development, where they work on access to WASH, access to energy, access to housing finance, land titles, etc. The second would be, empowering them so that they participate in the governance related to all these issues and make the government accountable. And the third would be looking at these issues from the lens of climate change, because that is what is really going to impact urban areas very heavily in the coming years. Now, talking specifically on our experience about WASH. So when we started working with poor women, we realized, and of course now adolescent girls are also part of our work, what is their own definition of WASH? So their own definition of wash at that point of time, because when we started working, this was 25 years back, and India still now doesn't have complete access to wash, which is a basic right. So the issue was more about access, and their definition was having water at household level, having closed sewage like the formal sector has, having household level toilets, assurance of no water logging. So that would be realized through installation of stormwater drainage or paved roads, because in absence of those, there will be heavy water logging. And then waste management services. So that these was their definition of actual wash. So it's a very broad definition. Next. So how do we organize these women? Because, when we started working actually, we started organizing these poor women to actually start talking to the public sector and private sector, and getting them to invest in their areas in terms of wash or housing or any other service that we were providing. So a typical program of ours would look that in 3 years or 5 years, we organize the women, build their capacities, and they get the public sector to invest in their slums. So X number of toilets, Y number of water connections, or Z, paved roads will be constructed. So with a concrete deliverable at the end of the program. That's how we started the engagement. And what emerged as a model over a period of time, because we started working on network solutions. So basically network of sewage or a network of, water pipelines in the city which we were headquartered, that is Ahmedabad. Of course, we came up with decentralized solutions later on. But so every household in the settlement had to join the program, in that sense, list up for it. And so every household in the settlement was represented by one woman constituting a CBO. On an average, in middle class cities, or you would say tier 2 cities in India, the household size in slums would vary from 100 to 250 households. Of course, in Delhi and Bombay, it would go very large, like 7,000 households per slum settlement. But that's not the reality in other cities which are in the tier 2 or tier 3. And what we would do is that once these women were really become a part of a community-based organization and they listed up, we would, for these 100 to 250 households, elect or select 15 to 20 women representing the community-based organization. And these also included 4 to 5 adolescent girls. And we started empowering them in particular, both in holding dialogue with the city governments, and secondly, also technically started to empower them, making technologies, making technical processes very simple for them. So they are able to talk to the public sector or private sector on an equal footing. And it started happening that these CAGs were actually able to improve the wash in their slums. And when they started doing that, many community action groups at the ward level, in the same ward, because in India, the unit of delivery or implementation is a ward, would come together and would start working to address their other local issues in terms of, larger issues, say housing or housing finance, or probably even health if they required that. And then when there were several, slum settlements in different wards over a period of time became predominant and active, then the CAGs, 2 women from each CAG would represent to form a city level munch, which was called Vikasini. Vikasini is for development, and each individual women leader representing here would also be called a Vikasini woman. And, this became the framework for participation. Although in India, we do have the 74th Constitutional Amendment Act, which mandates the participation through ward level committees. It has not become it has not become active. Currently, there are no invited spaces for the urban poor to engage and to participate in. And so this has become our model. Next. So how do you really empower them then for, making dialogue with the city? And so there are 2 levels of empowerment. One is that, developing their own collective. So over a period of time, as they get empowered, the threat is that the collective will start looking at their own individual needs, the individual members, rather than representing the needs of the collective. So you have to constantly, ensure that they keep working as a collective. And so, here we will train them into why the need of a collective, what are the principles, what are the bylaws on which they should be working for their own areas, and how they should be including the most vulnerable as a collective and representing them. So it's basically capacity building to manage and govern the collectives. Some basic accounting, how to bring in transparency, how to audit your accounts, how to give receipts if you collect fees from the community for some work, that's all. And the other whole section will actually concentrate on, making governments and other stakeholders accountable. So what is the implementation action plan? What are the government levels? So where does your slum fall? In a ward, where is your muster station? Which offices do you go to for, for your wash requirements? How do you talk to officers? How do you make applications? What are the grievance redressal systems? So on and so forth. And again, very basic technical knowledge. So for example, if you hold a brick at 4 feet height and let it fall and it breaks, then it's not a good brick. So that allows them to monitor the projects that are undertaken in their areas by the government. So that's how we actually build their capacities. And then the other process, which is very technical, will also include other aspects of WASH. Specifically, what I wanted to say is when we started working about 25 years ago, it was more about access. Now it has also broadened to include resource management of the WASH. So how do you manage water scarcity? How do you, look at water quality? And so how do you demystify the science in very, layman's terms so that they are able to talk to technologists and scientists and the government on the same table? I'll give you some examples. Next. This is just a sample, to come back to WASH and making cities ODF, because India very recently had the Swachh Bharat mission, which was claiming of 100% or universal coverage only in terms of toilet. And when we started working on that, and this is not for an urban area, but it will equally apply to an urban area, but to a rural area where we had given household level access of toilets to all households. And then what did it take, even after giving access to toilets at the household level, what did it take to, change the behaviors? Because the behavior change would really actually go beyond provisioning of services. So when we started, and so we involved the community action groups in this, and when they started talking to their own communities, they realized that, what was difficult was, one, that there were, notions about the fact that how the technology would work. So people used to think that the soak pits and septic tanks that were dug would get filled up, and so we don't want to use them more. We will only use them in the season of monsoon, otherwise we will continue open defecation. Then they also realized that, the older people and the children were, the target communities, because they continued defecating in the open, older people because of long-standing habits, and children because their parents used to encourage, their parents didn't want to encourage them and watch them and change their behavior to take them into toilets. They did not have that kind of time. So what did you actually do after giving? What did the community action groups actually do? So for example, they started counseling house to house. So apart from the general awareness, this house to house counseling was done with each house. Then solving the technical issue, if there was any technical issue with the toilet functionality, they tried to solve it, right? And monitoring house to house. Then, and we also understood that that behavior change, I'm sorry to say, but needed a little bit of enforcement. Also, it was not merely awareness generation. So it has to be a combination of awareness generation, reaching the service, and a little bit of enforcement. So giving flower to convey message, then provided information regarding health effects of doing open defecation. And this was all house-to-house counseling. Then areas where they went for open defecation were identified and cameras were put there so that, people stopped using those places because toilets were already provided at the household level. If not, then, they really spoke loudly so that, the households nearby heard them, their neighbors heard them, and that would put peer pressure on these communities to stop, especially the elder, to stop the open defecation. They also locked the household level toilet because then what happened that if the elderly, the household toilets were locked because of the elderly who went outside, then the other family members would start objecting and they would pressurize the elderly family member to start using the toilet. So that was done because in the same family, you found some members were using the toilet and some continued, like the older people and the children continued defecating in the open. And then they held the people's hand and direct them and all this was directed them to the toilet, and all this was done in the morning from 4 to 7 and 8 a.m. And that was only possible because the community action groups were trained and they were there available locally within the same area. Then also they went to click the pictures, and ultimately after doing all this, still 2% of the population remained which continued defecating in the open. So this is just an example how the community action groups and the women were empowered to work. Next.
Bijal, your time is up, so kindly wrap it up.
Yeah. Just the next slide. So we went from access to resource management and we decided to teach them the systems thinking approach in terms of water. So we took up a water cycle and like evaporation, runoff, groundwater management, map each of these on a rope. You can see the yellow tags, and when one tag was pulled, then every element got pulled. So they understood that water resource management is a cycle, and you have to work on the entire system. Next. We have revived the wells in urban areas. And these are actually, the water level is actually being mapped by the women. So all these water levels which are being mapped are, the CAG are trained to map it over a period of time so that they understand how water evaporates during non-rainy season, and during rainy season, how the level increases. Next. Here I am also, you can also see the women have been trained to look at the water quality, how to undertake this test, and report on the report card which has been developed. And they are now trained to understand that if certain parameters continue beyond the normal parameters, then they have to approach the government laboratories or the private laboratories to find a solution. So this is how we really empower the women to take care of themselves and the most vulnerable in the community.
Thank you so much, Bijal, for taking us through MHT's principles and grassroots level engagement and capacity building. May I now request Raman to come forward and share his talk?
Yeah. Thanks, Sindhuja, and also WRI for arranging and initiating this topic. Because this topic, quite often we talk a lot, but only little happens when it comes to action on the gender equality and disability and social inclusion issues. And few know also about how to make this happen in a country like India, wherein the scale of operations are much larger than anything else. And scale of India, when we talk about, we need to also understand the scale of inclusion that we are talking about also is very huge. So in urban India, when it comes to urban India, the challenges are even higher. large number of people to be included. The urban poverty and the people need to be included, come close to large proportion of urban population. So that adds to the kind of challenges. And when it comes to inclusive wash, what does it mean by inclusive wash is something, so far, I mean, till yesterday, I could not find a peer-reviewed definition for inclusive wash. But yesterday there was a paper in Lancet, Pacific region, journal, and Jane Wilbur et al. Has written about a very important, kind of definition for inclusive wash. I'm copy pasting it here in want of, in the chat box in want of time. Otherwise, if I read out that entirely, it may take little larger time than expected, but I'm unable to copy paste for whatever reason. Okay, so I'll try that. So this paper essentially talks about, I'll just bring the gist of it. There is no agreed definition of inclusive wash. We define it as a process which addresses the barriers to accessing and using water, sanitation, and hygiene services faced by people who are vulnerable to exclusion, including people with disabilities, older adults, people living with chronic illness, women, girls, transgenders, and non-binary people. And for people with disabilities, inclusive wash means effectively participating in and informing wash-related research, policy, and programming design and implementation. It goes on further, but it is quite important to get into a definition when it comes to inclusive wash. So we were trying to do this when I was part of developing the inclusive wash strategy, a sanitation strategy for the state of Chhattisgarh. And recently I'm working with the Ministry of Drinking Water and Sanitation for developing a guideline for inclusive sanitation as part of the Swachh Bharat Mission 2.0. So these are quite important in that. And when it comes to inclusion within urban, one thing is there, even within the space, we need, inclusive strategies, because urban is also not a it's not a homogeneous, kind of landscape. You have large cities, you have small and medium level cities, you have, emerging towns like the small towns, medium towns, and also in our country, there is something called the census town, which prepare to become a town within a few years or so. And in terms of definitions of population, in terms of definitions of less agriculture, etc., it has already become a town, but the township needs to be given to them in a larger sense. So when we are talking about urban spaces, quite often we limit our urban discussions into the larger cities. And then if at all we are discussing further, we may add the smaller or middle level cities and some towns which are having some importance of district headquarter or something like that. Beyond that, our urban discussions are also not going. So that is something to be looked at also. So we need very different approaches for understanding and intervening in the urban landscape. Within that, even after the larger cities and the smaller cities, when it comes to the small towns and medium-sized towns and census towns, even to realize the excluded population within the spread, because it's a what you call, it's a graduation happening from a rural area or a large dense village to a urban area. It's in a growth kind of period. Nothing is defined. So within that, to find and operate on urban inclusion becomes even more complex. So that complexities are to be realized. So in this light, what I'm going to do very quickly is to narrate some of the experiences of us about getting these things done in terms of catalyzing exclusion, not necessarily doing exclusion, catalyzing inclusion by it's a vital mistake, sorry, by governments, because governments can do this better. So how to equip our governments in order to achieve scale of inclusion in the manner it is desired. So that is where things are. So one is, the first of all, in the toolbox was quite useful, as Elin presented. So first part is realization. So we help the government by way of conducting gender and water kind of participatory measures with the community, how the officials can conduct this, making them to participate in such platforms, wherein the load of women was to the community as well as to the official, why to focus on gender aspects here, and similarly disabilities and various other excluded categories and most marginalized categories, so that realization happens at one point. And then there are consultations and interface meetings, those kinds of things. In Chhattisgarh we had conducted with the sanitation mission of Chhattisgarh, all the officials sitting at one side of the consultation bench. It was a group of people with disabilities, various disabilities sitting and saying their difficulties, and on the other side of it a group of transgenders speaking about their difficulties about sanitation, and then women speaking about the need of female friendly kind of toilet infrastructure and menstrual hygiene and related issues. Within that menstrual hygiene issues, disabled girls and women speaking about their added kind of difficulties about managing menstrual hygiene. So those kinds of realization kind of is needed for officials to really kind of take it up and get convinced about these issues. Then you need to identify gaps. In that identification process, you need to deploy different tools. It can be research, it can be immersion by way of staying in the location with people for a longer time and try to observe the things, try to observe what is happening, what is not happening, who is participating, who is not participating, who is getting benefited, who is not getting benefited, and then try to find out the reasons, etc. The other way is for the disability part, we did the 3 phases of survey in Chhattisgarh. One was disability survey, wherein it was a quick identification by community of who all are these people, and then going further to those people specifically to understand their needs in detail, and then once trying to fulfill the needs, going to their functionality kind of assessment using occupational therapist and those kinds of people, so that what is made is actually useful for them rather than it is not just becoming a namesake of activities. Then you need to go for understanding and communicating why this kind of changes are needed, wherein meetings with authorities, support in planning, policy making, strategy making, guidelines making, those kinds of supports are required. And then you need to go for planning for equality and inclusion, which is a major kind of exercise. So in Orissa, what we did with some of the officials of various departments which are supposed to provide water, sanitation, and hygiene officials, we worked with them on kind of using a tool called Making Rights Real, MRR tool. This was developed by WASH United. So WASH United and WaterAid worked together over there using this tool. End of the exercise, actually one of the problem for many officials were that they knew that there are rights and they need to impart those rights to those people who are eligible or entitled for that. But the problem with them was that they didn't know how to do it. So that how part, and to realize which are these rights, how these rights are coming within the job description of them, and how specifics are to be done. So if you have a tool to do that and to check whether they have done it or not, so that is where the Making Rights Real really helped them. And similarly, when it comes to implementation, capacity building is a very important initiative for all these officials. Making Rights Real is a example, but there are many other ways of, like, for toilet, if you make household level toilets converted into accessible toilet, the ordinary household level toilets, converting it into accessible toilet, you need to understand what kind of disabled people are there within that household, what kind of needs are there, and what all are the accessible accessibility tools that they require. There are some specific requirements will be there, some additional fittings may be needed. So those how to get them in the market, how to fit them in a proper manner. So the engineers to masons to those people who make the design, all of them would require some kind of hand holding. And then you need to also sometimes in the government the available resources may be limited. So we worked in Chhattisgarh with the Southeastern Coalfield Limited to provide an additional gap filling funding to the state government of Chhattisgarh for implementing the accessible sanitation, so that some of these specific requirement, of additional fittings and all that is met. So for that, to also, intervene in the supply chain so that they are available in the local markets whenever they are needed. So then you need to do an analytical documentation and evaluation again to look at again something is excluded within this inclusion process. Inclusion process needs to be very carefully looked at about not to miss out the vital things there. So these are something to be looked at. Then we need to get things by government. We may need to these processes needs to be simplified. If you make it in a very expanded and structured manner within the time frame of missions, they may not be able to do that. So how to simplify this at the practical level is also an issue to look at. And in COVID kind of a situation, the urban poor and the most excluded people are they are facing further exclusion at this point. So you need to also understand how these tools and processes can be very quickly used for adding support to those excluded population, the women and girls and people with disabilities, sanitation workers, waste pickers, women in manual scavenging, those kinds of. So we need to understand who all are those excluded population in our kind of circle. So with women and girls, we worked on female-friendly toilets. I would suggest one very important, small animation video prepared by 5-minute animation video prepared by Anveshi in Hyderabad. So Anveshi is a group. They have made this very very interesting film called Ka and Key in Search of a Toilet. I'm trying to paste something in the chat box. Yeah, it has come in. So thanks for that. So this YouTube video, if you can see, that talks about the difficulties of women about finding a public toilet that is suitable for their first of all, they won't find it. If at all they are finding it, it's not useful. So how to make it available and useful for women is a question that we need to look at. So we have developed guidelines for female friendly toilets, and that later become the Swachh Bharat Mission Urban has come up with the guideline, but there is a gender inclusive toilet guideline within that one chapter. So these are something very important to do. And then you have the Chhattisgarh initiative on PWDs, I have already told you. And so you need to look at sanitation, water, hygiene infrastructure, how to make them accessible, how to make it useful for the people. And then, those who are working for sanitation, how they are excluded from many of the things and how to make them into the inclusive, kind of circle. So that is one thing, the health, safety, equity, dignity of the sanitation workers, especially women engaged in sanitation work. And then urban poor and migrant workers, water supply systems for the congested slums and informal settlements is something that you need to really think about, small kind of changes that can make the rush. Of course, if you would have seen the water tankers supplying water in the slum areas where pipe water supply is not available, and people jumping into, I'm wrapping it up. So people jumping into those. So how a social design can be developed wherein the water tanker can fill something into a local collection tank, and that collection tank has multiple taps where people can, in a discipline within their time frame and convenience, collect water. Those kinds of things are to be thought about. And finding out the most marginalized and missed out in urban area is something that within the even informal settlements, we have people to be we need to search for most marginalized, and within that the people with disabilities and some specific kinds of people, women, of course, I've already told. So this something, these learnings, how to catalyze the policies for inclusion translating into action is an important area that all water sector organization can look at and add to at this very crucial point in time. Thank you so much.
Thank you so much, Raman, for sharing your experience and those strategies. May I request Saswati to come forward with her presentation, please?
Thank you very much, Sindhuja. I'll share my screen.
Yes, please.
Oops. Is it visible?
Yes.
All right. Thank you so much, everyone. And I would like to talk about COVID-19, WASH, gender and social inclusion, um, features of a recently initiated project in Nepal by my organization, Asian Development Bank. And this project was conceived by a team comprising Lakshmi Sharma, Shiva Paudel, and Shuvecha Kharka, gender specialist, and me. So, with your permission, I'll go ahead. So, interestingly, Elin spoke from a global perspective, and Bijal spoke about household and community level perspectives, and Raman spoke about the definition of inclusive wash and how to translate that into an urban landscape. And all of them spoke about partnerships, safety, how to address access barriers, capacity building, accountability, etc. So this project that the conceptualization of this project that I'm going to present today is all about translating it into actions at the local or municipal level. So we noted that there were considerable urban challenges being faced by secondary towns and small towns in Nepal, which were being aggravated by the pandemic. And this was particularly faced in the border towns around India. And the municipalities reached out to us for support. Um, and we understood from initial consultations that there was inadequate public hygiene facility, lack of basic medical services, then weak capacity for community engagement and weak capacity for design in all of these municipalities. So we applied for a grant from the Japan Fund for Poverty Reduction, and the grant was approved in June 2021. It's a very small project, but we hope that it will bring about transformative changes and lasting changes. So this is the institutional framework and the towns where we are implementing the project with the Ministry of Water Supply at the helm. And they also chair the project coordination committee, and the Department of Water Supply and Sewerage Management, which also has a project management office. And we also have as a partner the Nepal Water Supply and Sewerage Training Center. And there are project management offices in the eastern and western region. These project management setups were already in place for other ADB projects, and we decided to use that for this very small intervention. So the first output that is envisaged under the project is to create essential public facilities and services to block interpersonal transmission of COVID-19. So this includes mobile hand washing stations, mobile toilets, which are sex segregated, and these will be placed in marketplaces. Existing toilets, existing public toilets are being refurbished to be inclusive and barrier free. And elderly women, children, and PWD friendly multi-purpose shelters are being designed that will have fever clinics, oxygen related equipment, and will serve as quarantine centers for excluded and vulnerable communities that have no place to go to when affected by the pandemic. Then essential medical screening equipment and proper protective equipment for primary healthcare facilities, and health consultation desks to be provided. And these are going to be set up in primary healthcare facilities in water and user and sanitation committee offices. So this is very specific to Nepal, where before the municipal system came in, the communities used to form their own committees for management of water supply and sanitation, and that system goes on even after the municipalities have been formed. And we thought it would be good to involve such community-based organizations. So the first one was all about infrastructure creation, and the second output is about behavior change, community mitigation measures to be strengthened. So JC sensitive. When I say JC, it is an ADB kind of terminology. I understand you call it GEDSI with disability included, but we consider social inclusion to already cover disabilities. So using that parlance, JC sensitive behavior change campaigns, improvement of basic health literacy among women's groups, youth organizations, community-based organizations, training for manufacturing of home-based soap and disinfectants among excluded and vulnerable communities. Now in Nepal, in the context of our project towns, which are bordering India, there are specific vulnerable communities. These include indigenous peoples groups, Dalits, Madhesis, women-headed households, then transgender and persons with disabilities, and many other vulnerable people. So all those have been identified and defined. And then female community health volunteers to be mobilized, and community champions to be trained in the project towns to keep on reinforcing the awareness campaign messages. Otherwise, we find that BCC often, this behavior change campaigns often fail without reinforcement, without incentives, without monitoring, just as Bijal was mentioning earlier. And then output 3 is about strengthening of institutional capacity of the selected local governments to contain the COVID-19 pandemic, to have emergency and preparedness plans with JC responsive approaches, health and safety protocols to be in place, then staff to have to be trained and to have increased knowledge and skills to follow such protocols, then sanitation and waste workers to report increased capacity to disinfect public spaces in accordance with those protocols, and training and capacity building organized in communities to support O&M of the facilities, the operation maintenance of facilities created. So what we did differently in this project was actually that in many of our ADB projects, most of our projects, in fact, we have something that's called a design and monitoring framework, which has a set of indicators with outputs and outcomes, which are defined upfront. And then the project performance is measured against those indicators at the end of the project completion. And then we also have a separate gender equality and social inclusion action plan, which is also monitored, but not as carefully as the design and monitoring framework. So in this project, what we did was we integrated the design and monitoring framework and the JC action plan and created one monitoring framework. So that's something different about this project from all other ADB projects that are being implemented across Asia. And extensive stakeholder consultations have already begun. This is the detailed design phase that we are in, and incorporation of gender equality and social inclusion features is one of the key aspects of detailed design. Let me give you an example. I spoke about multi-purpose shelters. Now those are being designed in a modular fashion, so they can be changed as per the requirement, and they will be usable by children, so the toilets have to be child friendly. They'll be usable by women and girls, so specific needs of women and girls are being taken into account. They are being consulted, particularly in poor and vulnerable communities, to understand their specific needs. Then different excluded groups, vulnerable communities are being consulted. And so there are this management of those facilities will be mainly by women to provide a sense of security. So all those aspects are inbuilt in project design. And having processed that grant, we felt the need to have a special focus on sanitation workers in Nepal, because we feel not too much work has been done on the issue of sanitation workers in that country, and also on training of sanitation workers both in the public and private sector, and of municipal officials. Awareness generation and sensitization of the community in their attitude towards sanitation workers. And we also want to propose conduct of a hackathon in the sanitation sector, where we want to encourage innovative ideas and support a startup company in Nepal to develop sanitation solutions, which will then be piloted in maybe one or two selected towns, because we don't have too much money. And then we hope to come up with guidelines for scaling up of interventions across Nepal. So with that, I end my presentation. Thank you very much.
Thank you so much, Saswati. You were on time, and it was a great presentation. I would now request Marlena to come forward with her presentation. Would you prefer me to share, Marlena?
That would be great if you can.
Yeah.
Thank you.
Just give me a second. Yeah.
And you can go to the next slide. Thank you. So I would just like to start with a definition of disability to get everyone on the same page. Disability can be a limitation in function or capacity. It can be caused by environmental or personal factors, and it can be permanent, temporary, from birth, developed later in life, or visible or invisible as well. And as you can see in the graphic on the right, some disabilities may include wheelchair users, or people who use assistive devices like canes or walkers. Maybe they're amputees, but others can look just like the person below, and you might not be sure what disability they have, but maybe it's mental illness, maybe it's invisible, but it's still valid and real. And 1 billion people around the world, that's 15% of the world's population, is actually disabled. And so as someone myself with a disability who works in the climate change space, I'm personally invested in governments and decision making, including disability and disabled peers in their planning. Next slide, please. And just to give a little bit more background context on how disability affects people who live with disabilities, there's a medical versus social model. And for decades, disability activists have really been promoting that social model on the right over the medical model, because the medical model says that the problem lies with the disabled person, that they need care, they're housebound, they're sick, they're a drain on resources. But the social model instead argues that it's actually society, it's the lack of accessibility, it's discrimination, stigma, lack of universal design that disables people. And so this just helps you understand that disabled people really move through a world that isn't designed with us in mind. Next slide, please. And there's a deep connection between disability and poverty as well. And the other speakers touched on this a lot. Poverty increases susceptibility to health problems, and people with disabilities may be unable to access certain WASH needs. Next slide, please. And just to highlight that climate change is really having such a big impact on the world's poorest and most vulnerable people. And 20% of those are people with disabilities. So this inclusion isn't, just to be, it's really necessary because so many people around the world are disabled, and climate change impacts may even cause disabilities themselves. So this is really important to be including disabled populations in planning. And just another note, disabled populations may have limited access or resources in order to effectively respond to climate emergencies. And compromised health could make them also more vulnerable to infectious disease, to climate events, to ecosystem loss. And people with disabilities are more likely often to have difficulties during things like required evacuations. Next slide, please. Thank you. So specifically relating to WASH, people with disabilities may face physical or social barriers. A lot of times there's limited consideration or understanding of the particular WASH needs of people with disabilities. Raman was describing that, disability is not a monolith, it's really varied. So speaking with different people of differing disabilities is really important to understand exactly their needs and what specific accessibility will help them. So in thinking through how to get better access to people with disabilities, planning should include the accessibility of the infrastructure itself, of hygiene activities, the stigma and discrimination that people with disabilities face, and the fact that the land and geography might also be causing difficulties itself. And then the lack of visibility and voice of people with disabilities in WASH planning, community decision-making, it should really be addressed. And sometimes this limitation of physical and social barriers may look like there's no toilet in a disabled person's home, or perhaps the closest toilet isn't accessible. Perhaps there are steps to reach the toilet. So just a few examples. And next slide, please. So what does disability inclusive WASH mean? Raman was saying that there's no set definition, and I think that's really important to keep in mind. But there are a few key guiding principles that can be followed to try to really actively engage people with disabilities in decision making and making sure that WASH is as inclusive as possible. Actively including disabled people in WASH planning is a big one. Identifying the specific WASH needs of people with all types of disabilities because they can look different and require different needs. Ensuring that WASH facilities are accessible, including the infrastructure, including at home or in school or in the workplace, and modifying designs if needed, and ensuring that there's universal design that encompasses everyone. Ensuring information is also accessible in multiple formats, for example, written or spoken or in Braille. That's really needed as well. More investment in WASH access. Many of the speakers mentioned this as well. There's really a big gap in between what's needed and the money. And then just to reiterate, safe, inclusive, and accessible WASH will really ensure benefits for all. When things are made more accessible, it doesn't only help people with disabilities, but it often helps everyone. And it improves health outcomes, helps reduce the workload of families with caregiving tasks, and can reduce the risk of spreading disease. And next slide, please. And so this is from UNICEF, just a few more additional ways and key messaging around inclusive, accessible WASH, encouraging participation of people with disabilities, addressing that stigma and discrimination they may face, raising awareness, considering disability in design, including universal design, and designing and building WASH. I already mentioned, according to universal design. And then the next slide just includes a few other key actions, and these can be made available as well as the next slide, which has a few more resources. But just to give a little bit of background on why including people with disabilities is so important, and that it doesn't just look the same for everyone. Thank you so much.
Thank you so much, Marlena. I mean, thank you for sharing the needs and also the checklist that we should keep in mind regarding people with disabilities in any inclusive planning for cities. Thank you so much. We are at the end of all presentations and moving on to the discussion part. Please do share your questions in the Q&A box. I would now request Ayushi to come forward and take over the discussion.
Great, thank you, Sindhuja, and thank you really to all the panelists. We covered the what, why, and how of mainstreaming social inclusion in water, sanitation, and hygiene sectors. Really informative and insightful case studies, examples, resources, and tools shared by everyone here. So really thank you for participating.
Sorry for
yes.
interrupting. I think Raman will have to leave by 7 p.m. Just wanted to ask, we are over time. Is the rest of the panelists okay to be here for another 20 minutes, please? And okay, I will take that as a yes. And perhaps we can start off with Raman because he needs to leave.
Yes, that sounds
I
good.
actually also need to leave quite soon, but I'll stay as long as possible, but just for you to know.
All right, perfect. Yeah, thanks.
Thank you. Thank you. Appreciate that and appreciate your time with this. Actually, Raman, in your presentation, the very first sentence that you said really struck out to me was, we talk a lot about it, but very little has actually been done. And then, of course, you told us what some of the barriers and challenges are, but I want to start with you maybe discussing what is the way forward, especially as it comes to maybe some national level programs, like you mentioned the Swachh Bharat mission, and you talked about a state level program in Chhattisgarh. What are some key couple of things that are needed to push this mainstreaming agenda forward to make this the norm, rather than a thing that gets done when certain actors take charge of this?
First of all, I think, yeah, that's a very important question. First of all, the implementers, the accountability part of it, which many of us have mentioned. So the implementers' accountability and responsibility about inclusion needs to be fixed. It cannot just be a principle. It needs to be seen as a non-negotiable principle. So that non-negotiable principle only can deliver what we are trying to do here. So you need to introduce incentives for pushing this. I have documented best case studies of inclusive action in sanitation mission, a Swachh Bharat mission, and I have seen that in 9 states there were district level officials who went out of the way to support the most needy populations, including women, people with disabilities, transgender communities, and all that. But I always wonder, why should they go out of the way? Why should they be needing to go out of the way, wherein there should be a way for actually doing these things? The mainstream way should be there. So there should be some incentives for taking this up, and also there should be clear disincentives for not taking this up. So if someone, the problem of our country is that the gap is so high. Even if you fill the gap for 50% or 60%, that will be seen as a major achievement. But the remaining 40% will be with this most needy and most marginalized populations. And, it becomes a unwritten norm that they can be excluded because, you have already scored whatever you are supposed to score. So this, within that score, unless and until you make clear compartments of, if you are scoring half, okay, fine. Within that half, at least this much should be, not at least this much should be, you should have special initiatives done for covering all the, possible people from the most, disadvantaged section. So that kind of a policy push, we need to have. And then, we need to have all these tools, because many people at the officials, they don't know how to do it. So you need to have, supportive tools and assistive, kind of things. And also not only the, government and policies, we need to have the social and, the ecosystem quite ready to support these kinds of initiatives. Currently, we don't have ecosystem support. If you want to have a female-friendly toilet in a community toilet of a rural area or in a small town, you don't have anything supplies available in that, and they will have to bring it from somewhere else. So how to make that ecosystem available is also something that we need to think about. So I've listed all the things in the detailed discussion, but of course, I'm happy to provide those in a further resource manner, because we are developing now based on an analytical documentation of what all good and bad experiences we had, how we could have been done, we could have done it better. So those kinds of things will be coming very soon, and you can expect that in a month time or so in WaterAid website, we will have these resources.
Great, thank you. Yes, and definitely agree with, making things non-negotiable, making this the norm, and providing the necessary tools. Really looking forward to the resource you mentioned with the, best practices and case studies. I think that'll be really helpful. But speaking of, yes,
I'm sorry, go ahead. Now, because there was something that I had already committed before, and I cannot push it forward. Sorry for that.
No, absolutely. But thank you. Thank you for your time.
Thank you. Thank you so much.
But as one of the key things that Raman mentioned were tools, so I'll turn to the HerCity project now to talk about maybe what has your experience been in, really spreading the word on the need and the importance of this tool in urban planning. And have you ever faced any pushback or any convincing that you had to do to technical stakeholders, especially when it comes to, looking at this from a social lens and really taking forward the principles that are a part of the HerCity tools. So Elin, would love to hear from you.
Thank you. No, I would say almost the opposite, that we get a very, very positive feedback, particularly from public sector officials and more people working in the field, more kind of a feeling of finally we have this kind of toolbox with everything in one place, and that can kind of support us. So, but obviously, there might be pushbacks or other types of comments from other communities, but not very loudly. So more of kind of a relief that a bit as our previous friend said, like, how do we gather all these good practices and all these things in one place, and how do we stop reinventing the wheel, because the process is, no matter what a city looks like and where it is on the globe, there is a process that kind of follows the same dynamic in a way. So, of course, you need to provide tools that are flexible, but I think for most you could find things in, for example, the HerCity platform that could apply to your context, and instead of, again, setting up the checklists, finding the right tools for the assessments, finding new ways to design with perhaps people with disabilities or differently abled, or younger children, or women that aren't used to be part of the discussion. So, I mean, having everything in one place is usually something that's very appreciated.
That's great. I mean, and certainly, like you said, there are a lot of resources out there. So having everything in one place, and not having to redo this work and these methodologies that might have already been established is so important, and to learn. And I was really impressed to see that your tool has been used globally. So just if you can share maybe very briefly one example of where your tool was used that really shone through the success of the toolbox.
So, I mean, all the tools, or basically all the tools, have been tested a lot and used, I mean, individually in different contexts all over the world. I mean, UN Habitat may be located in Kenya, in Nairobi, but it is the global headquarters of a UN agency. So our scope is global. So we do work a bit in Nairobi, but mostly, globally. So having said that, these tools, it's nothing that we just invented like that. So we took it, we gathered it from various actors, and we also took the tools that we've been working with during decades, and put it in this spot where everyone could access it. But one of those that get a lot of attention is the block by block approach. Where we actually use Minecraft for urban planning, together with youth groups and girls. It's particularly, really an advantage, because all of a sudden those that might be a bit more skilled in computer games or a bit more techie finally has the advantage compared to perhaps an urban planner. So that is very, it's digital Lego basically. So, and it's very, very useful in the way that, as it's so blocky and squarey, you don't get stuck in the details. You really discuss the functions around a block. I mean, this is a block of water, or this is a block of garbage. And you really talk about what it means for the community and how you could deal with it, instead of getting into the details and the technicalities of the professionals. So that is one of the tools, but there are many others as well.
Very cool. And what a creative way to have, the youth be a part of this discussion as a very important voice.
But it's the future citizens. I mean, they're already citizens, obviously, but the future inhabitants. And I mean, if you're planning for another time scope, you can't just, listen into what the elderly population has to say, because, our lives tend to change, and the way we deal with everyday challenges, and I mean, youth is the future. So if we want our cities to work in 100 years from now, or 50, I mean, that's the best source of expertise we have.
Absolutely. So important to have diverse voices in decision making. And, that was a point that was brought up by almost all of our speakers, is to have participatory decision making, to have platforms where different sections of the society can raise their concerns, but also provide solutions for what they need for their communities. So I wanted to touch upon this a little bit more, and maybe have more of our panelists join in on this and talk about what does it take to make participatory approaches meaningful. There are cases where on paper it sounds great, but when you actually get to the ground, it might be tokenistic. It might be, in a way that, sure, you hear it, but you don't incorporate it in your programming. So Well, Marlena, I see you on my screen, so I'll start with you. Do you have any thoughts on what might it take to make it a meaningful engagement or meaningful participation when it comes to WASH programming?
Thanks, Ayushi. This is a really good question. I don't know that I have like the silver bullet solution, but I think just to reiterate, including people with disabilities and youth and women in the actual planning is really key, as well as like through the process to see what's working, to follow up and see if anything's not helpful, to see if years later, if something that was accessible is no longer accessible. I think that, as I mentioned earlier, disability is vast and varied and doesn't look one way. So keeping that in mind when making these plans and decisions is really important.
Great, thank you. Thank you for sharing your thoughts on this, Marlena. Bijal, since you work with communities so closely and for so many years in so many sectors, I wanted to get your perspective on this. What has been key in making sure that communities participate and they come forward and their voices are heard when it comes to their leadership in technical sectors?
So I'm going to give you a general, thought on what I think on this, and then probably proceed to answer your question. I do really think, that the tools, the processes, sorry for being a little bit skeptical, and the resources that we have been talking about, as our co-panelists from UN Habitat said, they are available and they are available in abundance. And what they will not drive the change, I'm sorry to say. What will drive the change is the creation of champions. Yeah, so, and then what they will enable the tools and resources to do is to do the inclusion in a little bit better way because of the use of the tools. But the change has to be driven by someone, and one really also needs to invest into creating those kind of champions at all levels, from the communities, at the government level, at the private sector level. And then, of course, if later on they use the tools and resources, probably it would help them to enable the change in a better way. Two very important things at least the India level, if I talk about, I mean, despite having this Swachh Bharat mission, although it was a bit limited because it focused only on toilets and did not focus on wash in the larger sense, is that, still so many, especially for the urban slums, where the poor women and the disabled and the other vulnerable communities reside, it is still linked with having legal titles or tenure. So you cannot still ensure, universal coverage, which is the first step to the change. You forget about behavior change if you don't have access to infrastructure. Provisioning of wash is still linked to tenure, and we really need to delink it because it's a right, it's a human right, which has been prescribed in our constitution. The third thing I think, which is most important, especially vis-a-vis the rural and the urban in India, is that rural has very strong participatory frameworks, the Panchayati Raj framework, where at the Gram Sabha level, participation is ensured. Unfortunately, the urban areas have the 74th constitutional amendment, but where ward committees are, prescribed as a framework for participation, but it has not at all been implemented because urban areas are very, very complex spaces. So we need to do that first. And then only the guidelines, the resources, the manuals, the blah, blah. I'm sorry for being a little bit skeptical, but will be useful. So that's my submission. And I always feel that, equipping the most vulnerable to be able to talk at the same level to the scientists and the technologists and the governments, therefore demystifying all these processes in a very, very, and technologies in a very, very simple language. Is very, very essential, and investments into capacity building, I think, is very, very essential in that sense, because for them to come at the same level and for them to have a voice and the other stakeholders to listen to them. Yeah.
Great, thank you. Yeah, I think those are very insightful comments and really linking some of the higher level policy programs to the ground realities of some of the work that you do. So thank you for that. Saswati, I'll come to you now. A really interesting presentation on one of your upcoming projects. But I saw in one of your slides that you had, when you were introducing the project, you had listed the risk levels. So I know that a lot of the multilateral banks follow these social safeguard standards, and they rate the risk of the project according to, the impacts it will have on the environment and the communities. And so how important is it to assess these risks, and how important is it to really quantify them in the form of the DMF or the framework that you had mentioned? How important is it to really analyze this data on how a technical project will impact different sections of the society, and has that framework been effective in driving this change? Go ahead.
Thank you for that question. Actually, the design and monitoring framework is all about targets and indicators, that what we really hard numbers and indicators that we want the project to achieve. Okay, but the frameworks that you're talking about, we do have separate frameworks like the resettlement framework or the environmental assessment and review framework or the indigenous peoples planning framework. So first we screen the project. Any project that is taken up by ADB or any multilateral development agency is first screened for the types of impacts it might have on the environment and on people, and whether those are related to involuntary resettlement or whether they're related to indigenous people's impact. So the framework essentially guides you in how you will handle such impacts when you're implementing the project. So in case of this grant project that I shared today, we just have the frameworks in place. We don't anticipate any negative indigenous people's impacts. There are certain towns where there are large indigenous people's populations, but we expect only beneficial impacts to such populations. So all our due diligence in that aspect will focus on how to maximize benefits to indigenous peoples groups, how to ensure that they have access to the facilities that are provided or created under the project. So that will be the kind of focus. And in terms of resettlement, we are generally avoiding resettlement. We are using government land in that project. So we are not acquiring any land, we are not displacing any person. We are taking government land that is free of any encroachment. So those were already identified, and the candidate towns were identified based on availability of such land and the need from the COVID-19 perspective. So these are some of the things that we consider while designing the project, and we need to screen projects early to be able to decide what level of support is required in terms of safeguards and what kind of resources are required to manage safeguards. So if it is, for example, if it's if a project has major impacts, then you need more resources for compensation payments, for mitigation measures, etc., and for monitoring as well. And this could be in terms of human resource as well. So so that's the kind of those are the kind of issues we look at in safeguards, actually. So I hope that answers your question.
Great. Yes, thank you. Wonderful. Bijal, I see that your hand is up. Did you want to come in?
Yeah, sorry. Just wanted to take this opportunity to talk to Saswati. Saswati, we work with a lot of small towns, about 100,000 population, and they are in real need for such support. And I was wondering if I could connect with you separately to probably talk about your project, and if you want to conceive another project in a similar manner. With your support.
Certainly, we can talk separately offline.
Yeah, sir.
Great. I'm glad this is an opportunity for building connections and to really learn and share knowledge. So great that these connections are being facilitated through this. I'll open it up to the audience now. I don't see any questions in our Q&A section yet, but if anyone from the audience just wants to come in and ask their question live, that's fine too. If you want to raise your hand. I'm trying to see if there are any, and if I may have missed anything, Sindhuja, please feel free to flag any questions down.
No, nothing in particular. I think you sort of covered most of it and was able to hear more in-depth, kind of replies regarding their projects. So that's great. Just like a small request though, if we could all get a screenshot together. I know the other two speakers are not here and should have probably done a little earlier. And I'm gonna see if mine works as well. All right. Okay, even though it does not cover the whole the panel, but that's something great. Aishi, did you have like any other question that you wanted to share with our panelists, or do we close the session?
I mean, I love talking about this, so I can go on and on. How are we doing on time?
Yeah, that's true. That's true. We're actually 20 minutes, beyond the expected time. So I would rather say we can close the session.
That sounds good to me.
Yeah. Thank you, everyone, for joining the webinar. I mean, it was a great ending to the Chat4Change series. I mean, covering the most important topic addressed by a great set of speakers as well. The recordings and the session details and a summary brief will all be available on the ACO website. Our next series would be the masterclass series under the Nudge Learning Lab. So we'll be diving deeper into many of the topics addressed and also approaches such as systems thinking and financing WASH interventions and community engagement. We hope that we could see you there as well and kind of exchange knowledge. I would specifically like to thank all of the panelists and also Ayushi for your amazing questions and for moderating along with me. Thank you, everyone, and please stay safe.
Thank you very much.
Thank you so much.
Thank you, and thank you, Sindhuja, for organizing.
Thank you. No worries.
Thank you.
Pleasure. Thank you, Marlena.
Right. Bye, everyone.